Okay. All right. Thanks, everybody. All good, Simon? All right. Super. Well, thank you both for your presentation. It was really interesting. I couldn't help when I was reading your bios and you're looking at your websites. Both of you, you were a dentist. You had your development firm, $3 million in revenue, and why start a startup? Why leave that comfy, being a dentist in business? Why start a health tech startup? What motivated you to make that leap in that direction? Questions open to the panel.
Okay, I'll start.
Okay.
Is this working? So, as I mentioned in my presentation, I knew early on in my career as a dentist that it wasn't for me. I couldn't see myself doing it for the next 40 years, and I just knew I couldn't do something that I wasn't passionate about. Wasn't completely sure what that something was. I don't know how many people really set out to be startup founders. I think sometimes it just kind of happens. You meet the right people, you're at the right place at the right time, and that's kind of what happened with me. I was at a point in my life where I was looking for something that I could build. I wanted to build a business, and I had actually experienced a very personal experience in my personal life when I met my co-founder Mike. My son at that time was about a year old, and I had just come back from the pediatrician's office, and he'd had some delays in standing and walking, and she recommended I reach out to a physiotherapist to come to the home and assess him and help us kind of get him moving along. And it was such a frustrating process because I phoned the recommended practitioner, and it took maybe a week for her to get back to me. I phoned someone else, they were on vacation for 2 weeks. I phoned someone else, they didn't work in my neighborhood. So it was just really, really frustrating, and I couldn't understand why there wasn't an easier way.
So personal experience prompted this desire to, how can I make a change then?
Exactly.
Okay. And Taylan, how about you? What motivated you?
I love building products. I think that's, whether it's for someone else or for myself, it's always been my passion. But I think I always had a special place in my heart for healthcare because of my parents.
Right.
So I built, and I realized this only after I started Avocare, but I built an EMR for my parents when I was 15.
Really?
That they're still using after 25 years.
Really?
So it's, I realized this after we started this, and I was like, oh, this actually is like, it feels like coming back home to, to be where I should be working on, because it's an area that I feel really passionate about. It feels really familiar. And then, but I only realized this after, meeting Vic, my co-founder, and it just happened and it came together. But for me, the kind of the decision-making point was just meeting the physicians and meeting going to the clinic to understand how they work and seeing the technologies that they're using. And as a technologist, for me, it was blasphemy. I was just, I was looking at these EMRs and these user interfaces, and I was saying, this could be so much better. And for me, it really came out of that, I think.
Interesting, yeah. Well, both of you mentioned the word passion, so it really seems like it's something, it starts off something emotional, either a personal experience, or in your case, like historically, your parents were in the medical field, doctors, and I guess just recognizing that, wait a minute, something can be different, and not accepting the status quo almost. So, sort of taking on that word of passion, when you started taking that first step now in building this ideas, their individual respective ideas, how did you sell it? How did you get the others to come on board? What steps did you take after that initial idea? Taylan, what do you?
We were really lucky because we had our pilot clinic in Liberty Village in Toronto, and they really helped us throughout the launch, and they were really hurting in terms of, they are really kind of progressive clinic in terms of client patient communication, and also they wanted something better than what they had. So we were able to work really closely with them and understand their requirements and then build on that. So it really came out of that. I think HealthTO was a big booster for us. You know, we were there very actively, especially in the early days, to, you know, talk to physicians. And then going from there, we expanded to new clinics. I think we're still in the stage of like early adopter clinics where, you know, people like, especially physicians who really see a different way of working.
Yeah.
So I wouldn't say that we are, you know, that everybody sees the same idea, but it's, you know, it's early days. I think everyone's going to come around to the same, you know,
Sooner or later.
So
the responses from physicians are, it's almost like a cultural change or a cultural shift where some may want to try something new where others will kind of stick with what they have.
I mean, you know, I had conversations with physicians who said, and who are not that older, but who said, no, I love faxing. And, you know, you can't really say much to that.
What's a
It's
fax?
great, you know, it's good for you, but it's not, that's going away. Like one way or another, that's going to go away. So, yeah, I mean, it's going to change, and some people are resistant to that, but there are a lot of people who are seeing the light and saying this is a better way of communicating, right?
And Dr. Klein, how about you? How did you get others to share in this idea of yours?
So we were lucky in the sense that, you know, the idea of an in-home appointment is not a new idea. I mean, doctors have been doing
house calls
forever.
Right.
So people are used to that idea. You know, a lot of people get a massage therapist that comes to their home, or there are other platforms that, you know, provide physiotherapy or multiple different services. But what we found is that there weren't many platforms where you could book online, you could pay online, you could have all your documentation accessible online. So a lot of that part was missing. But the idea of actually bringing someone into your home was something that people were used to. So, I mean, for us, I think you start with the people you know. Your first patients are going to be your friends and family, and anyone you could find who can test your platform and advocate for what you're doing. And, you know, we just kind of had that first group of patients using the platform, telling their friends and family, and it kind of just grows from that. And even now, that's something we're, you know, really proud of, is that I would say over 30% of our appointments are based on, you know, follow-up appointments and direct kind of word-of-mouth referrals. So it's really important to kind of get that first group of patients on the platform, and then you kind of just grow from there.
So again, sharing your idea, getting people who are excited about that idea and having them sort of test or pilot that idea. It's little by little it grows. So beyond family and friends who you can share your ideas with, what were some of the business-oriented partnerships that were important for success? Investors or other communities of practice? Who are some of the important relationships that others should consider in their starting their own health tech startup?
Okay, I'll take that. I think for us, I would kind of reframe it a little bit, and for us it was more about kind of surrounding ourselves with the right people, not necessarily partners in the business, but people who we could see as mentors and advisors. We're lucky that our office is in a company called Firepower, where they've got a bunch of portfolio companies from different industries and different verticals. And I spoke a little bit about that in my presentation, just kind of being able to draw upon people who've been in different industries, who've had different experiences, people who've built businesses, people who've sold businesses, people who invest in businesses. And I think it's really important, like especially early on, to just try and surround yourselves with those kinds of people. And we've been lucky to kind of just be in that environment already. But, you know, like you were saying, HealthTO, you meet tons of different people, lots of tech events, and there's a whole tech community that you can kind of really draw upon, and people who can support you and give you advice, so that you can kind
along the way,
get started.
And what tips would you offer to people who are, say they're new? How do they discover a startup or HealthTO or all these other organizations? Is it just word of mouth? They go to the local library? Where should they be trying to find these connections or the right people, as you say?
Yeah, I mean, if you literally go online and you Google, tech events Toronto, tech events Hamilton,
Yeah.
tech events wherever, there's so much that comes up if you just go and search through the
It's
events.
almost overwhelming.
It is overwhelming.
Yeah, I mean,
and
you can't keep up with
I
all
was
of
really surprised by
Yeah.
it because I hadn't been in this world at all.
Mm-hmm.
And when I first started, it was just like every day there's an event you could go to if you wanted to. So eventually you kind of get a little bit more selective and you kind of pick and choose the right ones.
The right groups, the right organizations, or right events to attend.
Yeah.
Exactly.
But also, I mean, people are really, I found that people are really supportive in terms of, bouncing off ideas and just, getting opinions. And I mean, we had really good feedback from all of the community events that we've attended and learned a lot from those. Yeah, I think our biggest kind of feedback board has been our advisors. I think having a really strong kind of advisor group in any startup is essential, and I find that a lot of people are really open to that idea nowadays, especially in Toronto with the growing community. So, if you find someone that you really admire and you value their opinion, ask them to be an advisor, and more often than not,
They're
I think
really to
people
share
are
some
willing.
advice.
Yeah. I mean, it's it's maybe a meeting every 2 months, but you can glean a lot of information out of those. So yeah.
So definitely, it's not the journey is not solo. You don't do it by yourself. You may have conceived the idea, but the advice you get, you seek out people's advice, you seek out feedback, and there's a supportive community, as you said, out there. People really willing to help.
Yeah.
It's fascinating. In once again, sort of going through the steps of the journey. Once you have the right feedback and the people and the partnerships and whatnot, what are the next steps that you took to start bringing things together, that really pulling it all together, and you start to see the vision you had become a reality? What were those essential steps that if others here in this room are considering building something, what would they need to know about?
Yeah, I mean, from my point of view, it always goes back to your first users and your first products, kind of like what is your initial product launch and what is that going to entail, right? So our first step was getting a bunch of physicians and front desk people into the same room for 2 days and just really tiring them out with questions and having them, air out all their grievances about how the system doesn't work and all the issues that they're experiencing, right? So that was the first thing that we did. I think we did 2 or 3 days. And
like a consultation, just asking the end users.
Yeah, it was just a round table, just gathering some information. And then out of that, we kind of started envisioning the product. And then we ran that by quite a few people, even before building anything, to just understand what are the absolute basic necessary requirements for such a product. So that's kind of where we started. And then one other thing that I did was I went to the clinic and just sat down at the front desk for a week, and I just watched them work. And by then I had done all the privacy training as well, so it was like everything was in context and I could understand what was going on. So that was really beneficial as well.
You raise a good point, because I think sometimes when people come up with some ideas, it's a good idea, but they lack maybe that the real world experience. So I like what you said. You sat there, you just observed what was
messy,
going on.
Right? The real world is messy, because like if you design a product in your room, you're going to think of all the best case scenarios and you're going to design this perfect little thing. To your point earlier, that's probably going to fail on the first day.
And I think that's something that's very important. That's why Hacking Health, we're trying to always include the patient. Like let's not get too caught up with the technology, as great as it is. IoT and artificial intelligence and blockchain and you name it. But at the end of the day, it's caring for people with their issues or problems, or in this case, physicians who are trying to help their patients. So I think that's we can never forget the human side as much as we have all the technology.
So I mean, to your point about kind of sitting in the reception and just kind of observing, so when we started, so there were two issues. We needed to build a tech platform, but I also needed to really try and understand and learn about the podiatry industry, which is not an industry I had been involved in.
The other side, you're more
I'm more on the
expert
side.
the other side, yes.
Yeah, so obviously I had to really understand how that works and how the whole clinic experience works and how the appointments work. So really we also sat down for a number of days and talked it through the customer journey from, what happens when they book the appointment and what happens when they come and pick up their orthotics. And we looked at kind of all the pain points along the way where, patients would be waiting longer than, someone else, or where the difficulties were. So really understanding the industry and understanding where the issues were and where you can improve upon them. And then the other issue was the tech platform. We wanted to see what else was out there. So what are other people doing? Are there other platforms that we could use? And so we spoke to software developers and platforms that had already been built from, all over the world. We had demos. We were just really trying to understand what is out there, what we could use, what we liked, what we didn't like. So we did a lot of preliminary research before we finally sat down and decided this is what we want our platform to look like.
And it sounds like this on-demand kind of service where people come to your home. Is it almost like the Amazon kind of where you just go to a website, you order what you need, and then it comes to your place? It's something sort of looking at other platforms and how they work.
Yeah, for sure. Looking at kind of other industries and looking at the convenience aspect of other industries and the way that they've really made it so accessible and so easy.
Right.
And then, like you talk about the fax, that doctors still love using the fax, and patients are still required to sit on the phone and listen to 20 messages and leave messages and wait for 6 days before they get a call back. So that's still happening, and so this is really what we wanted to change. Yeah. And
change takes time too. I mean, this is disruptive things you're trying to do. You're trying to shift long-held practices, and how do you effectively turn that around or change it? And I think also to the point about when you're not familiar with the area. Say someone has a great idea, but they think, I'm not a physician, I'm not a clinician. How can I change healthcare? Or you're a dentist, and how can I go into podiatry? What inspired you to say, well, I may not know everything, but I can still get involved in this area? Because I think maybe some of us here have good ideas, but maybe they figure, well, I'm not in healthcare, or I'm not in technology, but I do have an idea. How can we overcome that sort of that hesitation if we don't have enough knowledge? What steps do you take?
Yeah, so I mean, what Taylan was saying, you didn't come from a direct healthcare background, but you can learn. You can, if you want to, you can learn anything you want to learn. And I think it's just so much easier now than if, this is a great time to be a startup founder, because that information is everywhere and you can just access it so easily. We talk about the HealthTO events and TechTO and Hacking Health, and there's so many opportunities to learn and to speak to other people and to learn from their experiences. You can really learn anything you want to learn.
So don't ever stop learning.
That should not deter you. Yeah.
Interesting. Same
experience. I totally agree. I mean, you do need the right guide or the person who will give you access, because it is a closed system. You can't just show up at a clinic and start asking questions. But if you're willing and if you find the right person, it is completely possible to get into this industry. I don't think there are that many closed doors, because people are interested in technology. There are many people interested in change and innovation, and Toronto is a great place for that. Or in general, this area, I think there's a lot happening.
Yeah, and I think this is, again, going back to the word of that I mentioned before about a culture. I know when I was speaking to a colleague, and she had mentioned how the technology is there, but it's almost that the culture has to change to accept that, how can we actually leverage this new technology to make a change? It almost goes to the question of, why is it so difficult to disrupt healthcare? Why are there seemingly so much red tape and privacy and all this stuff? I mean, it's all for a good reason. But why is it so difficult? I mean, is it what are the steps? How can we take steps to say, listen, how can we disrupt it? What advice would we offer to those who want to make change in a seemingly very large, overwhelming system as is?
Yeah, I'm of two minds about that, because we are seeing what happens to extremely fast disruption in other spaces, right? Mm-hmm. I don't believe that an Uber or Lyft should have been able to expand so quickly, right? I think they should have been regulated. Now, the chance that we have in healthcare is that it is already regulated, because all these privacy rules and security rules have been put in place in time, so that no startup can come over and just take over the world without by essentially outpacing.
No Amazon Health tomorrow, or
right. It is a danger. I mean, you shouldn't be able to outpace lawmakers, right? By just essentially throwing VC money at them.
Yeah, and technology goes faster than
it
law.
goes fast, right? So in one way, I believe, even as a technologist, I think having so many regulations is a really good thing. But on the other hand, what we've seen firsthand with Avocare is that because of the lack of open data policies in Canada, we've hit a brick wall when it comes to EMR integration, for instance, right? So we flew to Vancouver and we met all the TELUS people and we talked to them and all of that, and after 2 years we still don't have any integration points. We cannot get access. Doctors cannot get access to the data that they are the custodians of. So they can't say, no, I want to use this solution, right? They don't have the right to. Because
so TELUS is sort of
they won't allow anyone else to access their walled garden, right? Or I mean, they will, but only select people who have the right connections and who do the right profit sharing deal, right? So I think it's moving in the right direction, but it is a problem. That to me is the biggest problem in against startups in Canada right now.
Canada at the moment, Dr. Klein.
Yeah, I mean, so for sure, we had a lot of challenges at the beginning, just finding information. When we were looking at HIPAA compliance and HIPAA compliance, so all the privacy and security of patient data, that was one of the big hurdles that we found at the beginning. We spoke to the Privacy Commissioner of Ontario, and that they are the people that regulate these laws. They couldn't even tell us what the laws were. So I'm sure you've been there. So a lot of red tape to get through in the healthcare space. Just kind of be aware of those things. We don't work with OHIP. Our services are covered by private health insurance. So trying to get real data from the insurance providers is another big challenge that we're facing today. Data on how much has been spent in different services, etc. So that kind of information is not easily accessible. When you're looking at raising money and being able to tell investors this is how much was spent in each vertical, it's very difficult to find that information. So it is something that you kind of continually try and get around.
Well, to that point, setbacks. Again, we're on that journey here to launching your startup. How do you handle setbacks, and what were some of them that you encountered that maybe there's some advice that you can share with others to say, don't do it this way, do it this way?
Okay, I can start. So I think for us the biggest thing was the tech starting off. It took us a lot longer than we thought it would. It took us a lot longer to get out to market. Something, as I mentioned, something I would definitely do differently if I ever do this again is just build something a little simpler, and then just start and get out there, get to market with something that kind of works, and get feedback from patients. And we've got two users, our patients and our healthcare practitioners. So get feedback from whoever's using the platform, and then iterate on that and develop some more, and then keep going. So that was a big one for us that I think we've learned a lot.
So keep it simple.
Keep it simple.
Interesting. And then just kind of launch something simple.
Right.
And get feedback. So iterate and
exactly.
get feedback. Okay. Taylan?
Yeah, I mean, because of my background, tech wasn't an issue for us. I'm happy to say. It was the product building process was actually fun, and yeah, we did exactly that. We launched within 5-6 months with a really simple product, and we launched that. We ran that pilot for over 6 months at a single clinic just to learn. One thing that was really beneficial, both for learning but also for overcoming hurdles, was like feeling better about the product, was running support. So to this day I still do support on Avocare, like alongside the customer support team, because it's the best way to learn all the issues that the users are having. So we have the little chat bubble, and I'm always keeping an eye on that and responding to people, and it's great because like you solve someone's problem, a 70-year-old trying to register, while you step them through, step by step, and they, at the end of that, they thank you and they say, this is great, and that makes your day, your month, right? So that's really the most important thing for me, like seeing people use it and seeing people love it and say thank you every once in a while. Is the best reward for me. That's great. So whatever other hurdles you're dealing with, at least you have that, right? So for me, that's the thing that keeps me going.
Keeps it going. So I guess when we think about startups and entrepreneurs, we often talk about long hours and a lot of hard work and setbacks and all that. For those who are interested in pursuing this, what's the personal side? Like, what are some of the personal sacrifices that did you have to make? Was there any struggles and lack of sleep, or sort of a confidence in the idea, or losing confidence in the idea? What's some of the things that maybe people should be aware of if they're starting? Like, what are the sacrifices they make?
I see any startup journey is, I think, a marathon, right? Like you you're gonna run. You have to run a long time. It's more about being able to stay there and stay in business and keeping on going. If you want to build a sustainable business, that is, there are other ways of doing startups, but if you want to build a real business, I see it as a marathon. What I've learned is that in healthcare, it's more like in one of those ultra marathons or whatever, like it's the 160-kilometer run or whatever it is, right? Like you really have to be in it for the long term.
So everybody has to be in good shape to go into this film.
So for me, you have to really stay really sane, right? So you have to pace yourself. You can't do everything at once. You have to accept that. I'm as a startup founder, you're always working, but you also have the flexibility. So I spend, a lot of time with my family, with my daughter. That's my meditation, right? I make sure that I go to the gym every day. I have time. I have personal time. Those are critical things, because without those, you can't keep the business running. You will have too much. For me, I will have too much anxiety. Too many problems. So.
Because so often there's almost like a running joke where it's that entrepreneur that has no sleep and it's just running on, bus fumes, but that's not recommended for this field. If you want to be successful.
Yeah, maybe it works for some people. It doesn't for me.
Yeah, I guess everyone's different, but it's I think important to be aware of, find that balance between what you're pursuing and your own sanity.
I think so.
Yeah, I think it's just kind of remembering that this isn't going to be a 9-to-5 job. It's your business. It's, if someone has a problem at 9 o'clock at night, it's, you're not going to wait until the next morning. You're going to deal with it then.
Right then,
so, and it's finding a balance, as you say, between your personal life and your business and what keeps you sane. You don't really have a routine. Every day is different. You might have a task list for the day, and maybe 1 or 2 items might get checked off because new things are going to be coming up all the time and you're going to have to deal with them. So just kind of be okay with not having the routine and not having the structure of a typical job. And it's the same with me. I leave the office at 3 o'clock to go pick up my child from school, and then I'm on mom duty for the next 4 hours. And then I can get back to work at 8 p.m. when the kids are asleep. So you have that flexibility, but it also means that we were just talking about it when I came in, that you're on your phone all the time, and you're always looking at emails, and you're always making sure that Stripe is working and the payments are coming through, and if something isn't working, you kind of get anxious. So that's going to be my thing, that I need to try and let go of my phone for
a while.
Because you do need to just keep it balanced.
Keep it balanced, yeah. You know, it's interesting, as I asked you that question, even though some of the personal sacrifices, I saw both of you still smiling.
Yeah.
So I think that deep down, again, we go back to that word of passion, being passionate about what you're doing, because there's personal sacrifices, there's things you got to change in your life, but still that passion that you have for what you're doing kind of sustains you in those the more challenging times. Yeah. So again, continuing with this journey, obviously you've got more people on your team to sort of help out. How was it? Was it easy to let go a bit of your creation to others, to sort of delegate some of those tasks to others, or was it, no, this is how you're supposed to do it. No, this is how you're supposed to do it. How did you kind of like let go and let each of your companies sort of kind of go on their own or grow?
Okay. So, I mean, at the beginning, you want to be involved in everything. And I think that's okay at the beginning, because you want to know what's going on and you want to be part of that foundation that you're building. But eventually, if you really want to grow a business and scale a business, you have to learn to let go. You have to give up some of that control. And you've got to be able to trust the people that you're working with, or you shouldn't be working with them, you know. So that's really important, to be able to let go, and then be able to have some kind of method or system of being able to track what's getting done, what people are doing, and coming together and being able to look at everything together, but knowing what everyone is responsible for and being okay with that. I think that's really important.
So letting go and trusting others. And I think the key word that you said is, if you want your business to scale, to grow, this is essential. You cannot hold on to everything. Same experience with you, Taylan?
Yeah, absolutely. And it's not just the business, it's also your team, right? So Michael Lopp, who also goes by the name Rands in Repose online, like he's been writing about like human management for many years. I've been following him, and he gave a talk in Toronto a few years back. And one thing that he said really struck a chord with me. He said, you have to delegate until it hurts. Like, it should hurt you to give that task away, because that person is gonna do not such a good job as you would, but you still give it away. Because that by doing that, and by maybe even failing, that person is gonna become better at their job. So you kind of have to let your team learn through their mistakes too, and accept that not everything is gonna be perfect. So I try to exercise that as much as possible, because I know that it makes my team better and get better.
So that's also to be cognizant of the fact that, like you said, it's not just a business; it's your team that is behind the business. So allowing them to grow into their roles, and I think that will just benefit the whole business itself. It's I think in terms of just the growth of a company and how things are moving so quickly, learning, as we mentioned before, staying aware of what's new. When we have the resources, or before you hired your team, how did you go about like hiring them? Who was your HR department? Who was your marketing department or your communications? Did you have to wear many hats besides the founder hat when you were doing these things, starting up your company?
Well, when you're starting, and we started really small, like you can't have a marketing department and an HR department. We're doing everything. So you're learning about everything that you never thought you would ever have to learn about. So, but as I said earlier, I think it's a good time to be a startup founder, because there are so many, there's an app for everything, right? So, you don't need an accountant anymore. You can get an app for that. So, there are technologies and platforms that can simplify things and make things more efficient, and mean that you can get started with a business without having a huge team. So that's important to remember.
The technology is there. So no one should feel, again, getting back to that feeling of I'm not familiar with that area, I shouldn't start it. Even if that person doesn't have an HR department or or any link to human resources, that again, don't be discouraged by that. You can still learn. You can still find things out there that can help you out. Taylan, is that the same thing with your?
Absolutely. And I mean, I don't know. Even in my previous life as a product consultancy, going from like one person to over 30 people, we didn't feel that we needed any. We didn't have an HR department. We didn't have accounting. You can get away with outsourcing or being a little bit more clever around like which tools you use and which tactics you use, and you can grow a business. Now, of course, you can't scale further. I'm sure you need more people as you grow, but below a certain size, I think you can run a very efficient company that way.
Should we do some audience questions?
Yeah, we can definitely kick into that. I think what we can do, I just wanted to like sort of wrap up again to sort of the journey here. Here we are, 2019. What technologies on the horizon make you excited right now or spark some interest in your companies? Like, what do you look and you think, wow, I got to keep an eye on this? If you have some thoughts on that.
So I think I mentioned to you as we were looking for the Starbucks when we got here a couple of hours ago, and we walked past the 3D printing lab, and we kind of knocked on the door and went in, and they were really nice to show us around. And that's something that we've discussed, utilizing in our business in terms of 3D printing the orthotics. So, things like that, things like virtual care, like what you're doing. Really anything that makes the process more efficient, more convenient, more accessible, better quality. And you kind of see these similar themes across all these different startups that are coming up and businesses that are already established. Things like the application of AI.
Right.
I recently, coming from the dental world, obviously this was of interest to me. I recently heard about a company that's using AI in diagnosing decay on dental x-rays, and the founders are actually Canadian. So something like that where, I graduated from dental school 10 years ago, and I was still, manually dipping the x-rays into the chemicals and waiting 10 minutes for the images to transfer. And now we've got AI diagnosing decay in, in dentistry. So things like that are just kind of cropping up all over healthcare. So I think it's really interesting. Yeah.
Something is going to be happening soon on the horizon. Taylan, anything out there that's right now?
Yeah, I think, as I mentioned in my talk, it's the neural networks are the most interesting thing for me right now. We're actively utilizing them and being able to train statistical inference on large amounts of data and like gathering these results. There are, when applied intelligently, I think it has really interesting implications in healthcare. I don't think it's going to replace doctors or physicians or even front desk people anytime soon or ever, really. But I think it's going to make their job a lot easier, and I think it's going to make the patient experience a lot better.
Interesting, yeah. And again, back to that whole thing about the patient experience. At the end of the day, all the great technology that we have, it's really we're dealing with patients again, humans who are in their moment of need. So I think with that note, I'm just going to open it wide up to the audience here. We have two startup founders, health tech founders. So the questions I didn't get to, please feel free to ask. There's some great valuable knowledge between the two here.
Okay, so you guys both mentioned accessibility a lot in your talks. I'm just wondering if you found that obviously technology makes things a lot more accessible for different people with different abilities and stuff. But at what point did you feel ever like there was sort of a boundary, like things were at odds between privacy and accessibility, or security and accessibility, or like what do you think? Like, do you think those things can conflict, and how? Big question.
Yeah, it's a big question.
You guys don't mind repeating the
I
question?
can. Okay,
Also, so we
I'm
get it
gonna
on
start.
tape properly?
So the question is regarding accessibility or privacy?
Yeah, so when accessibility sort of becomes at odds with things like privacy and security, especially in a place like healthcare where there are big concerns, did you find any kind of issue with that?
So the overlap between accessibility to technology as well as maintaining privacy What were some things? How did you deal with that?
Yeah, I mean it's definitely a big issue for us when we were starting, was looking at all the privacy and compliance requirements, because our practitioners are using our system as an EMR system. All the documentation and all the charting, the appointment charting, is housed in our platform. So that was definitely a big challenge for us when we were starting out, before we heard about MedStack, and how they kind of helped us build out that infrastructure. So that's definitely something that's difficult, in healthcare specifically, when you're storing healthcare data. So having to keep all of that in mind in terms of, and it's not just about the technology and where you host your information, it's the processes, and it's about training your practitioners and having all that documentation about how to control that data and access and transfer of that data. So, a very valid kind of concern. And then just doing kind of everything that you need to do to make sure that you've got all those privacy and compliance regulations in place.
Thank you.
Yeah, I
Hopefully that
think
helps.
I'll just to add on to that. When people think about security nowadays, I think the general public thinks about, my database got hacked or someone accessed my server, which really in reality rarely happens. It's mostly human error, right? So it's mostly about how you train your customer support team, or how you get your people to think about patient data and what the patient is disclosing, and who you need to confirm that information with, and how much of that do you automate. Because we're dealing with things like, should a husband be able to access his wife's records? Of course not. But if they come to the support system saying, here's my information, blah blah, can I get access to this? Well, you should know to say no, and you should. So there's a thin line between being helpful and a serious security breach. So usually that's kind of what I think about nowadays when I'm thinking about patient and healthcare security. It's not really the technical part, it's more about the human elements within, and how you train those people and how you make sure you close those gaps. And we've seen many issues that we hadn't thought about, like we had front desk people who, we had a scare one day about like one patient getting email notifications, and then lo and behold, we learned that the front desk person was trying to help another patient by letting them access their terminal and logging into their account on Avocare on their terminal, which we hadn't even thought about that someone would do that, right? So we had to plug that. So there are all these issues that come up that you have to really think through, and it's not really about database security. It's more about user access, and it's about how people are going to use the system and where all those gaps are. So it's partially training, but partially also using technical tools to close those gaps.
Great question.
Thank you.
Dora.
So, what is the business model of a digital health startup? How can you make your money, basically?
So the question was, what was your
Business
business
of a
model?
digital health startup. How can you make your revenue? How do you sell? How do you convert?
Not easily.
So how do you get out of the red and into the black, so to speak?
Yeah. I mean, our business model is essentially we allow the clinics to bill their patients easily for any services that are not covered by OHIP. So we allow subscription billings for certain services. So some clinics prefer to charge a subscription fee for refill requests, or doctor questions, or notes, specific types of notes or forms that they can request. So anything that you can request online, the clinic can legally charge for, and we allow them to do that easily, and we handle all the billing and invoicing and all of that, and then we take a cut out of that charge. So the patients are essentially paying their clinic, and we take a service fee out of that. So the more patients use the online services, the better for us, and the better for the clinic. Because the clinics that we work with are family health teams, it's actually they prefer that the patient doesn't visit the clinic. The less they visit, the better for them, because the less busy they are. But they still can, charge for that patient to the government because they're on their roster. So our business model is very symbiotic with the family health teams in Canada. That's how we designed it.
And Dr. Klein, how
Yeah, so the way we work is we take payment from the patient. So patient pays us, and then we pay the healthcare practitioner a commission. So same as if they were working in a physical clinic. So we're not just a matching or a marketplace platform where we're taking a cut and then kind of leaving everything to the practitioner to kind of deal with. And that's also why the privacy and the patient data aspect was something we really needed to work on, because we're positioning ourselves as a mobile clinic. So we house all the data. We're in charge of all the back end in terms of distributing instrumentation to the practitioners, in terms of sending orthotics costs to the lab. So we kind of do everything that a traditional brick and mortar clinic would do. So the business model is similar.
Thanks for the question. Any other questions?
So we just want to follow up with this model. So for Karen, I'm curious about consult over text and online, and also you have a prescription renewal, right? So who is paying for that service?
So the question is about SMS communications and who's paying for.
Yeah, if you do some consult with a physician, my understanding is not covered by OHIP right now.
Yeah, exactly. So it's not covered by OHIP in Ontario yet. It is covered by OHIP or whatever it is in BC. But so it depends on the state. But basically, the patient is paying for that in Ontario. But the patient is paying the doctor, right? And it's at the doctor's. It's the doctor's decision or the clinic's decision how much they want to charge for that, whether they want to charge that patient or not, or what kind of yearly or 3-month subscription model that they want to charge for. So they define everything. So some clinics will say we don't charge for prescription refills online. It's all free. Some clinics will say we charge $25 per refill. So it's up to them.
So how do you see yourself with competition? For example, there are currently other private labs such as Maple, or there are other companies such as Tellus. They partner with Babylon as well, and also prescription-wise, there's Prescribe gonna take over, and they will offer free e-prescription across Canada. So I just wonder, how do you make yourself sustainable or competitive in this kind of environment?
Yeah, I mean, we see the primary form of healthcare in Canada is their family health teams. I don't think that's going to change very quickly, or if at all. We don't see that changing, primarily because it's a good model. It works, and it's nice to have a doctor who knows who you are and who knows all your history that you've been seeing for the past 15 years. Whereas, a company like Maple, you get a random doctor every time, and it might be great for executives at a company where they just want to get something done really quickly and they don't really care who they talk to. But I don't believe, I wouldn't want to use that, right? So I think as a company benefits, it might be really nice because it checks a box. And they have a good. I'm assuming that they're doing good with that business model, but we are more interested in how do we modernize the family health teams and how do we make sure that communication works better than it is today. To be honest, prescription refills are not a huge it's not a huge part of our strategy. We are more interested on the communication aspects, but it is something we offer and it works. We don't really care if you make money from the prescription refills. We're more interested in getting the messaging in place and getting that communication in place into as many family health teams as possible. Yeah. So, and right now we're at 5 clinics, and we're a sustainable business. So, the more we grow, the better. That's the way we see it.
So the industry is quite big enough to, if people want maple, if it suits them, that's fine. But your focus is still primarily in that area.
Yeah,
and that works.
And I mean, it's never gonna be a $1 billion business, but if you're in the frame of mind of just being a sustainable business rather than just growing, scaling up, I think it's okay to just be, to have I would love to have 1,000 clinics in Canada and just service them. I think that's a great business.
So not overly, doesn't have to be huge, but sustainable, satisfied, delivering better experiences than you had before.
That's the advantage of technology, right? You don't need 100 people to service 1,000 clinics. You need 10, right? So.
Interesting. Well, thanks for the question. Any others? Dora.
So is there any overlap between your services and those offered by eHealth Ontario? So they offer an umbrella and similar digital applications to patients and physicians, allowing the process of streamlining the healthcare service delivery. So you're basically a competitor, in my view, to eHealth Ontario. So do you see yourself as such?
I'm not super familiar, but I think they're more focused on the hospitals, if I know correctly. So and also I think there's been a shift in the market. So from day one, our focus was on messaging, right? We said nobody wants video communication because we interviewed a lot of people. We should actually do messaging because it's asynchronous and it actually saves you time. So we really doubled down on that, and pretty much everybody else went the other way, and they said no, to replace clinic visits, we should do video, which, as it turns out, wasn't such a good idea because actually nobody wants video. It's not great to do a video call. So if I remember correctly, a lot of companies are doing this, but I think eHealth as well, their primary focus was, let's do video calls and you can do appointments and all of that, but more primarily focused on hospitals and those kinds of environments, which is a different world, to be honest. We haven't really even gone to that route because getting into hospitals for a startup is very prohibitive. It's something we didn't talk about, but we were lucky in the sense that we could go directly to family health teams and smaller clinics. But with the hospitals, it's a 2-year-long process of documentation and regulation and all of those things, which we didn't have to deal with yet. We're ready to deal with it, but it's a long process. So yes, there's definitely overlap for sure. But I think we have an advantage in the sense that we have such good messaging services now after 2 years of doing this. And we don't believe that video is a good solution. So we're not really going to be foraying into that market.
Thanks, Roy. So we have time for about 2 more questions. Eric.
Thank you. Imagining that I was a pharmaceutical company or a medical device company, and I was trying to bring an idea like yours to market, and I had a prescription drug or something, I would often go and say, okay, so I'm going to do it this way, and I'm going to give you a placebo or do nothing. Do a trial, right? So in your cases, both of you said, I've got 2 different customers and a way of doing it. Do you have a way, can you imagine a way of measuring? So if we weren't using your solution, what would the other outcome be? Right? Do you know that your intervention is actually better than the old way of doing it?
So measuring success or measuring?
Yeah, that was effectively my question. How do you measure that you're actually
Better than the status quo?
the process?
Okay. So I think with us, one of the big value propositions of our company is the convenience aspect. Making an appointment convenient and accessible versus making it a 2 to 3 hour long process. And those 2 to 3 hours, that's a real stat. So it does take on average 2 to 3 hours from the time you pick up the phone and book the appointment to the time you can, go home with your orthotics. And then we can actually sit down and measure how many, minutes does it take somebody to book an appointment on our platform. How long is the appointment? They've been waiting maybe a couple of minutes in their own home or in their own office. So those are, like real metrics that we use in terms of time. With us, the biggest thing that we're saving for people is time and aggravation, and it's, the opportunity cost of that time. So really like targeting busy people who, those 5 minutes, 10 minutes, 2 hours are really valuable. So
They add up over time if you have to have numerous
follow up and repeat
Yeah.
appointments for sure.
Okay, so for people who are coming along and perhaps with a startup, do you have any recommendations for them to say, so how do you actually measure success when you take on this new project or new product?
I think one thing that we did that I'm really glad we did was gathering incoming phone volume metrics at every clinic that we worked with before we launched. So we made sure that they had those. So that's where the 20% reduction number comes from. We know for sure that from the day we launched to 3 months later, we were able to reach that outcome. So that's really the biggest metric that we go by, because that's that is the numerical showcase of how you make the clinicians' lives better and also the patients' lives better, because they don't have to call the clinic anymore. It's not because people are getting less sick, it's because we're there. And the other metric that we have is the revenue that we generate for the clinics, right? So that's also easy to stand by.
In your specific case where you mentioned you went from one end of the spectrum to the other end in 6 weeks, you had a particular personal diagnosis that took
right.
run about a 6-week path.
Yeah.
Would you guess that it might have been a 7-week path without using your solution?
I think more than the time, it's the visits to the clinic that are an issue for me, right? Like to me, it's ridiculous to have to make time in my day to go to the clinic, wait in line, see the doctor, and just get a blood work requisition form printed, and then I still have to go to the lab, and I had to do this 3 times. Now you have to go to the lab. We don't have the magical technology to do that at home yet, but at least I didn't have to go to the clinic, so that was easily 2 hours of savings every time. So that's 6 hours saved, and that's invaluable for me, right? As a business owner, as a parent, so yeah.
One more question? Oh, okay, let's go for this gentleman over here.
Yeah, actually, my question had to do with funding, because that's actually a challenge most startups actually face. So how were you guys able to source out the funds you require to start your business?
Okay, I can start. So
The question of funding. Yeah.
funding. So we've only been operational for about a year now, so we're pretty early on. We've really just been funded up to this point by our angel investors, so family and friends, starting the discussions to start funding for our seed round. We're, with the business model that we haven't needed a ton of money to start off with. Every business is different, and the requirements are going to be different, so that journey is going to look different depending on the business that you're building and how you want to grow. Maybe you can talk a little bit more about seed, but that's really been our
So
experience.
angel investors.
We're really only kind of in the early days of having the discussions with investors for our seed raise.
Yeah, so I don't have good news on that front.
I was looking for something inspirational.
Yeah, I don't know if the best question to close on, but we failed, to be honest. We failed to fundraise, and it was a really interesting experience. We did over 60 institutional and angel and VC pitches, and everybody said no. So it just wasn't a big enough business for them, right? The main question was, how does this turn into $1 billion business? And it doesn't, right? That's the straight answer. So you can spin it any other way, but it just doesn't work. So, I mean, you can blame it on us, you can blame it on the business, you can blame it on the funding, or the seed funding, the infrastructure in Canada, but we weren't successful. But it forced us to bootstrap, and it forced us to find different ways of running the business, and we managed to do it. I mean, so now I'm under no illusion. I'm extremely privileged because I already had my career and I already had a business that was successful, so I had resources to rely on, but it was still tough, and I wish we didn't spend the energy on trying to fundraise, to be honest, looking back in hindsight, because it is a tremendous amount of energy to prepare for those and do something that's really not natural, to essentially go to someone and ask for money. So it was not a fun process, and we failed, but we're better for it because we own our business, and we are bootstrapped.
So even in failure, there's something to learn there.
Always,
Yeah.
right? Yeah.
And just to follow up, if you've been able to break even, how long did it take you? Or if you haven't broken even, when are you aspiring to? I can see.
Exactly 2 years for us.
Okay.
Yeah, pretty much.
Yeah, so as I mentioned, we're pretty new. But I think you kind of have to just realize that most businesses are not profitable at the beginning, and it takes a long time to be profitable. And you're not profitable because you're spending whatever you're bringing in on growing the business and scaling the business. So as long as whatever you're burning is going to increase the value of your business and scale, then that's okay. You just have to kind of have that in mind, that the reality is most businesses are not profitable within the first kind of year or two. I mean, you talked about it, Uber, right? Like they're $120 billion business that burns through $1 billion every couple months. So, that's obviously on the other end of the scale. But the reality is that, it's difficult. It's not easy at the beginning.
And just to add to that, is making money the motivation, or is it really providing the quality service?
I mean, it's nice to be sustainable.
Mm.
I'm not lying.
Yeah, no,
There's
I
less
know.
anxiety.
You could sleep well at night, obviously.
Right, you can sleep better for sure. But I don't know. I'm not. I don't really care about having more than what I need.
Mm-hmm.
Right, like as long as you have the basics, and you really need more. So yeah, I think. The emotional support that you get from the business, from having a sustainable business, and from having a business in healthcare that actually helps patients and makes people happy is, I think, more than enough.
Mm-hmm.
Yeah.
And the same.
Yeah, 100%. It can't just be about the money.
Mm-hmm.
Like that can never be the only thing that drives you to succeed.
There's something
it's just
deeper
probably
than
not
that.
going to end well. It's got to be something, and especially in healthcare, when you're dealing.
Theranos? No.
Yeah, that didn't work out so well. So especially in healthcare, like you said, you're working with real people, real patients with real problems and their families. With us, people are inviting us into their homes. We're taking care of them. We're taking care of their families. They're trusting us to provide a medical service, so it can't just be about taking the money. Yeah, for sure.
Well, on that note, I want to thank our two wonderful guests, Dr. Karen Klein and Taylan Pince.
Thank you.
Thank you.